studies on the synthetic hormones are not all that great, and they're fraught with more problems. If you don't have estrogen, we know, say a woman had a hysterectomy, didn't have any estrogen replacement, she now has double the risk for Alzheimer's disease. So I often recommend hormone replacement unless you have a family history of breast cancer or uterine cancer. And even then, they're really working hard to try and answer the question, can these women take hormones as well? Because what we see is the blood flow to their brain is better, because without estrogen, and a lot of people know this, your skin's not as good, you wrinkle more, your bones are not as good, your heart is not as good, and your brain is not as good. So I've been encouraging a lot of my patients to really look at this issue in a thoughtful way.
Yeah, and it's more than just the menopausal symptoms that we see. With estrogen in the brain, we see an increased capacity to deal with pain. So it's not just
so interesting.
It's not just the typical hormonal menopausal symptoms we're thinking about your entire life, and as you age, you tend to experience more pain.
And so few psychiatrists ever think about hormones as being related to behavioral problems or emotional problems or cognitive problems, and it's a huge area that's important to deal with so that people can have their best life. And I have to tell you, I just resent the fact when someone, they'll go to a physician and they'll be, whatever, 60 or 70 or 80, and they'll go, well, you're just old, so, there's nothing we should do for you. And I resent that. My grandma died last year, and she was what, 99? 98. And, it wasn't until she was 92 we scanned her. And, I gave her some things that just made a big positive difference in her life. I want someone taking care of me till the end, wherever the end is.
Yeah, that's exactly true. And we were talking about earlier with the drugs. I can't tell you how many women come to me that have a need for hormone balance, and they're on an antidepressant. They're on a sleeping medication and an anti-anxiety medication, all three together. And I just think, what do these drugs do to the brain? So they don't have enough hormones, right? So that's going to affect your brain in a negative way. And we're giving drugs on top of that to sort of falsely suppress parts of the brain. So it's sort of like, to me, a double hit. Do you agree?
Absolutely. When you look at the anti-anxiety medicines and the sleep medicines, they are not brain healthy. They decrease brain activity. So if you could have given her progesterone, for example, which is the brain's own natural anti-anxiety hormone, it could have made just a huge difference by itself. So this is a very exciting area of clinical practice and research. Thank you so much.
Thank you.
Recently, my dog died.
Oh.
And I've been really heartbroken, or maybe I should say brain broken. And I'm wondering, what happens to your brain when you lose someone you love, whether it's a spouse, a friend, or a pet?
Oh, it's so sad. I just talked to a patient last week who had to put her dog to sleep, and she was so sad. And a lot of people don't get how important their animals are to them. I mean, we've been playing with Tinkerbell tonight, and your animals come to live in the nerve cell networks in your brain. And so they actually become part of who we are. And when they go away, they don't die in our brain. They still live. And I remember when Pollyanna died. Pollyanna was our Maltese. We had her for 11 years. So cute. And my daughter, Brianne, got depressed when Pollyanna died. She had nightmares about Pollyanna. Every time she'd look where the dog's dish was supposed to be, she'd just start to cry. And it was as if she'd lost, one of the most important people in her life. But it was one of the most important lives in her life because Pollyanna was still in her head. And it really wasn't until she got Madison, who turned out to be Pollyanna's grandniece, that Brianne started to sort of get to be more normal. But grief is such an important issue for us to deal with. And often when people go through a grieving process, they do terrible things for their brain. They start to drink too much because they can't sleep, they overeat, they, do a lot of things that are not good for them. When really one of the best ways to deal with grief is to face it. And there's often all the ants that go along with it. If I did this, if I did that, then this wouldn't have happened. And, they end up torturing themselves, and that totally just perpetuates it. I often say, welcome the feelings, sit with the feelings, cry, because crying in many ways is like a little seizure in the brain. When you cry, it really fires up your emotional brain, but then it can settle down and you can be okay. And also make sure you engage in all those brain healthy things, and then you will open your heart to bring other animals or people to occupy those nerve cell networks in your brain.
Thank you.
Thank you.
You mentioned several factors that may influence the quality or how a relationship is, such as consumption of alcohol or drugs. You also mentioned factors such as how the parents of somebody may have behaved. Just a question that I had was, do genetics play a role in this as well?
Genetics play a huge role. And we think maybe about 20%. There are a lot of people who think genes are everything, and genes are not everything. But they're important. If you have a family history of ADD, bipolar disorder, schizophrenia, autism, you are at higher risks to have problems. But fascinating study with bipolar disorder. Those people who had the genes for bipolar disorder, or they had it in their family, who grew up in fairly healthy homes, had their first manic episode 10 years later than someone with that same genetic vulnerability who grew up like Will's family in a chaotic home. So your environment really matters. So, how you protect yourself is you get on a brain healthy program. And with that, even if you're vulnerable to these issues, it can just make such a huge difference.
I wanted to know, casual marijuana use is so commonly accepted within the younger generation now, and it's becoming even more accepted now. I wanted to know how that affects your ability to even feel love and how it affects you in the long run.
What I've seen on scans is many people smoke pot as a way to settle down their brains. So in the show, I talked about a woman who had obsessive compulsive disorder, had way too much activity in her brain. And people with that often will use marijuana or alcohol or painkillers, things that settle down brain activity in order to just feel more normal. The problem is they get stupid over time. I mean, we see it decreases function in their frontal lobe, so they're over time less thoughtful. It decreases their reaction time, so they get more head injuries from being in car accidents when they're high. It's not good for your brain. Marijuana is not good medicine.
On tonight's topic regarding love, sex, and the brain, we've all heard the phrase or the saying, men give love to get sex and women give sex to get love. And I think we've all seen people who partake in these behaviors, many to high risk and self-destructive. What are some of the reasons, maybe psychologically and physiologically, for this? And for those who have some of these high-risk behaviors, how they might be able to identify and stop this and maybe get on a path to better health and better behavior?
So many couples have this issue where they use sex as a weapon. They use it as a hurtful behavior in their relationships. For people who get addicted to it, and it's going to happen more than ever because online pornography is so easy. to happen. We'll see ADD people have a much higher incidence of it. People who've been on their video games for a long time, they just need that next excitement, that next thrill. They're going to have more of it, and it's going to ruin their level of intimacy. And you know, it's a very good question. We have to be so thoughtful about it. Now, naturally, we're wired. Guys are wired to have as many offspring as they can. So, you know, we're always sort of checking out that girl. I mean, that's part of our evolutionary makeup. And girls do not have that wiring because, you know, one night can end up into a 9-month, really 20-year consequence where, you know, guys can sort of, they don't have the same level of commitment often to children. So there is this sort of natural wiring that makes it different, but at the same time, I'm very concerned about our society and always needing that next thrill in order to be able to pay attention to anything at all.
For individuals who partake in that behavior, it's really self-destructive for them, and they're sacrificing relationships as a result. What can they do to try to get on a path to better health?
For example?
Maybe a woman who gives sex out regularly just so she can try to get that love that she's missing.
You know, that happens so frequently. And you know, what's often the matter is her picker. You know, her ability to choose someone that is healthy for her. Because, you know, if you're in a loving relationship, you know, only give it out to someone who's going to be a good partner for you. And so they often have no idea, in large part because of their modeling. And these are people, often if they get into really great psychotherapy, they can sort of figure out, you know, this is not a good pattern for me. So if they don't have the role models, and often they don't, then learning new ways, but it takes a while to make different decisions. But I've seen through medicine sometimes, I mean, a lot of the people you're describing are people who have ADD that are girls that have it, and they really never knew that, but they're excitement seeking.